This exercise is going to strengthen some of your posterior shoulder muscles and your rotator cuff. What you're going to need is some sort of a light weight, a dumbbell, a can of soup, something relatively small to start. It can be an ankle weight, or sometimes just using the weight of your own arm is enough. Choose a weight that makes sense for your prescribed sets and reps. The idea is going to be putting your elbow on your knee or supported on something, and then we are going to think about rotating through our actual humerus here up as far as we can without our wrist compensating and without using our spines and rib cage, and then slowly controlling the descent down and trying to actively reach for as much range of motion as we can without this coming up. So when a lot of people start to load this, we will come down and the weight might pull you deeper, but we will lose the rotation. We are no longer getting rotation at the shoulder. We are then compensating with our shoulder blade. And so to combat that, you'll want to think about engaging your shoulder blade down and just kind of holding that position, not the elbow, but the actual shoulder blade, just kind of pulling it down towards your hip. And if you maintain an active contraction there, you will notice it's a little bit easier to find your end range of motion as you're doing this exercise. So you're typically going to want to go very slow and controlled, unless your program tells you otherwise. Going to perform these for the prescribed amount of reps. It should be pretty burny feeling and fatiguing at the end. Sensations we want to avoid are going to be any sort of pain. And then also, if we feel a pinch in our shoulders in the back as we are coming up, we don't want to move into that. We want to avoid that. So cut the range a little bit shorter. And then as we come down, we shouldn't feel any pinching in the front of our shoulder as well. If you do, you feel pain throughout, this exercise is probably not for you and you're going to need a different one.